Hello, Dr. David Beidebach, Chiropractic Relief Center. Today I want to talk about mid-back issues. Many people have them for a variety of reasons. It could be from years of sitting over a computer, a desk, whatever, an old injury that created some scar tissue and limits their motion, where they tend to feel this need to just get it to open up and move and so forth. Chiropractic is wonderful for that, but it's very important you understand what's causing it and what you need to do, because the combination of the two things together is amazingly powerful. Absent either one, it doesn't go as far, but stretching alone will do a tremendous amount, and that's what we want to do. So it could also be from a poor result of a breast augmentation or the repair of a mastectomy, which changes the leverage of the back through the pec muscles. It could be an old fall. It could be a clerical situation that we talked about, or with computers, a variety of things. Scar tissue doesn't hurt itself, doesn't have pain sensors, and it doesn't stretch though. So the problem is it makes the adjacent tissue work over time, and that can inflame once in a while, creating this back pain. So stretches, along with the typical ones that you can stretch side to side. Doorways are awesome. Get a bar through here. I recommend one like this. You can order from a lot of the online companies, where one for low $20 can be delivered to you, where it just hooks up real quick and it comes down right away. I like the permanent bar because then I can really trust my weight 100%, and I don't worry about anything about it. I recommend you too. But I'm stretching through my shoulders. I'm stretching through my mid-back. I can do it one, and I'm now really pulling through my mid-back to vertically open up a lot of those adhesions that bind. It's great for the shoulders. It's great for the hand because it has you repeatedly using your hands. If you have problems with your hands, that's another video, how to loosen those up. So I can stretch vertically through the back this way and obliquely through it like this. I can hang sideways to it, which would look more like this, where I'm doing it through different muscles. And really, I want to do it about 4 seconds each on each of the stretches. Big thing that's important is when I'm stretching and I'm feeling really good about doing it, don't let go on it because it compresses it. What you want to do is walk back up to it. All right, it's much more comfortable. And you'll feel the releases, and I don't mean audible releases, I mean just the stretch, but repetition of a good thing goes in a good way, like repetition of a bad thing goes in a bad way. So we do a lot of these. Doorway, this is on another video, but this also helps with the mid-back. It helps your shoulders. I'm using it and just letting my buttocks be the counterbalance weight to pull me through. I can change angles, lower, higher. I can also do it through the door like this, like that, and hold it there, which essentially is my head's going back. And I'm opening the shoulder blades when I go one way. I'm pulling them back when I go another. I'm opening them up, stretching out, elongating. You do that repeatedly for a few months, but slowly. Start off slowly. And go to your comfort zone. Don't try to do too much too fast. Maybe it's, you're doing the whole routine, literally, small routine and larger routine, anywhere from 30 seconds to 2 minutes at a time. Don't try to kill it all at one time. It's more about a little bit every day. I would do it once or twice a day for a while. Eventually, every other day will do wonders for that kind of a scar tissue problem and flexibility. Ligaments don't get circulation without movement, and when structures are uncomfortable, they tend to hold together and they don't move and they dry, they become brittle, and they bring in arthritic development to help strengthen it, which is a bad thing in the long run. Arthritis isn't occurring because of your age, it's occurring because of neglect. Get function, and it just doesn't happen hardly at all. Dr. David Beidebach, Chiropractic Relief Center. Have any questions, give a call. The chiropractic and that together is deadly good, but the stretches alone are pretty doggone powerful. Thank you.